South Africa's Border Management and Immigration Anti-Corruption Forum conducted an awareness campaign at the Beitbridge port of entry on Tuesday, delivering a clear warning to border officials that anyone involved in corrupt activities will face the full force of the law. Chaired by the head of the Special Investigating Unit, Advocate Andy Mutiba, the forum reaffirmed its unwavering commitment to rooting out corruption within the border management and immigration sectors. We are going to come back to that story as we are covering one of those big stories. It is almost the end of the year. We now go to another big story that is on the table, where the 7th Africa Scientific Conference on medical products regulation in Africa comes to an end today. Now, the conference brought together policymakers, regulators, scientists, and industry leaders to discuss regulatory harmonisation and its impact on health, product manufacturing and trade. The event aims to boost Africa's ability to produce safe and quality assured medicines and vaccines, reducing reliance on imports. Currently, over 90% of medicines are imported and less than 1% of vaccines are produced locally. And to discuss this, we are joined on the line by Chimwemwe Chamdimba, a Principal Policy Specialist at the African Union Development Agency, the AUDA-NEPAD. Chimwemwe, good afternoon, and thank you for joining us on Africa Update.
Good afternoon. Thank you for having me.
Now, talk to us about this conference. It's aimed at boosting Africa's ability to produce safe and quality assured medicines and vaccines. Now, what strategies were discussed and how will they address current challenges in local production on the African continent?
Well, indeed, this conference addressed issues around ensuring access to medical products by our African populations, focusing mainly on looking at regulation of medical products as an enabler, focusing on how do we ensure that the work that the regulatory authorities do, because they are gatekeepers. When we are talking about access, when we are talking about manufacturing, when we are talking about trade in medical products, it is a different ball game. We need to ensure that we are trading in products that are of good quality, that are safe, and that are effective. That will really address our public health needs. So you can literally see that the regulator becomes a gatekeeper. If we are to talk about manufacturing, the regulator has to ensure that we are producing products on the continent that are of good quality. When it comes to trade, different African countries have national regulatory authorities that look at the products, that approve products that are circulating in the market. And that in itself sometimes can be a hindrance in two ways. Firstly, if it is not done in a timely manner, if the regulator doesn't have capacity to effectively regulate, it takes time. And that time that is taken also delays the time that the product can get to the patient. Secondly, if I am a manufacturer and I want to go into different markets on the African countries, you end up, meeting different requirements by the national regulators in the different countries. And in that way, it also delays how much time, it takes time for the product to get to the patient and also product entry into the market. All these can sometimes become barriers to trade, barriers to manufacturers, because if there's so much fragmentation, if there's so much diversity when it comes to regulatory systems, manufacturers are not interested to invest in such a market because they know that it's not an enabling, environment for them to manufacture and trade. So in this conference, really different stakeholders, as you can see, this dialogue is not just about the regulators themselves. We need to come together, the regulators, the researchers, the manufacturers, even the patients, the patient groups, the civil society, the healthcare workers, the policymakers. So we were all together in one room and we unpacked how we solve the fragmentation in regulatory systems, which we already started in harmonizing at the continental level through the African Medicines Regulatory Harmonization. And with the transition, actually currently, we have actually formally started the African Medicines Agency. So we have moved from the programs that we were implementing to harmonize our regulatory systems to now start off the African Medicines Agency. So we've really focused on setting up an African Medicines Agency that is an enabler to both trade as well as manufacturing on the African continent.
Now, just looking at, if we go back to the COVID-19 pandemic, which was a huge lesson for not only the African continent, but the globe as a whole, what potential impact could this have on Africa's pharmaceutical industry, especially with the experience that we have coming from the COVID-19 pandemic, and how Africa was left on a back foot, so to speak?
Exactly. We as an African continent, as you're rightly saying, we were left on the back foot. We were more on the receiving end. And the conversations around ensuring that we have our own secured spaces where we have available to respond to our public health needs, they did not only start with COVID. COVID just highlighted the real challenges that the continent has when it comes to vulnerabilities of our supply chains. Because you may recall at that time, even though vaccines were being manufactured elsewhere in the world, the supply chains were disrupted. We couldn't get the products that we needed. And similarly as well, when we came to a point where we were able to do a tech transfer for a COVID-19 vaccine, a technology transfer, and it was manufactured in South Africa. You remember how difficult it was as well to export that product, that vaccine, to other African countries, really highlighting the typical policy challenges that we have, the typical challenges that we have when it comes to regulation, also our vulnerabilities, because we don't manufacture our own products. We're waiting for others to for us. And
now,
even
Chimwemwe, unfortunately, we have run out of time, but I have to just wrap up with this. The issue of security, promoting health security, was this highlighted? And, just in 15 seconds, what were the outcomes for this?
So for health security, I think at the center of health security, it is access to quality services. And access to quality services, it also requires access to quality medical products. You can't talk about health services without medical products. So it was highlighted that for us to ensure health security, we need to ensure that we manufacture on the continent, we trade on the continent, we work together and solve our continent.
Chimwemwe, thank you so much for your time on Africa Update. We'll leave it there for today. That was Chimwemwe Chamdimba, a principal policy specialist at the African Union Development Agency, joining us on the line.
Você é fluente em português?